So I think the success was due to the engagement of the community partners. I mean, like a lot of states, we had really engaged community partners. The lead organizations that we used for the in-person assisters organizations, they were just out in the communities. They really knew their people, their communities, and they really got the message out. So that I think is the main thing. Agents and brokers worked really hard. Hospitals worked really hard. Community clinics worked really hard. Everybody worked really hard in the community to be able to get people engaged. The volume was something we didn't expect. I mean, we opened the call center with 80 customer service reps. We projected, maybe 1,500, 2,000 calls a day. Starting October 1st, we were getting 10,000 calls a day. So we ramped up our staffing and were able to do that. So by February, we had 500 customer service reps. Now, post-open enrollment, we have about 300, and we're still getting 5,000 calls a day. The first step was to try to get people enrolled. The next step is to really begin to educate people about how to use the insurance that they have. So we're going to be doing a lot of things in this next year around health literacy and education around trying to use their benefits. Also, how do they make choices around their coverage also. But we still have a little bit of emergency room use, but Harborview is our safety net hospital in Seattle. So one impact was their uninsured rate last year before the open enrollment was about 12%. This year it's now about 2%, so a really big impact on the uninsured. But the other thing they're reporting is people coming to the primary care clinics now as opposed to going to the ER. Yeah, so we're all the states are working on their sustainability budgets for 2015. And it's just going to be a discussion with the legislature this year about what they will want to fund for us. So we've just proposed our budget with the board. We'll be working with stakeholders over the next few months or so, and then presenting it to the legislature in January. So what they did was they approved a budget for us and a funding mechanism for us, but they capped our budget temporarily at $40 million. And we, at this point, projecting to need more than that, 20 to 30% more than that. So it'll just be a process of going back to the legislature, finding the revenue for that, and then raising the cap. The second round, it's going to be a little bit harder because you got the people that were really looking for this. So now we're trying to get the people that are a little bit harder to reach. So the first thing for the next open enrollment period is to get people who have coverage now renewed. And so we're working on the renewal process and trying to make that as user-friendly as possible. If your income didn't change, if your plan is still available, you don't have to do anything. The other thing that's different for us next year is we got additional carriers interested, so that's really interesting. We'll have more choice. One of our existing carriers came in with a rate decrease, which was pretty odd and very exciting to have. But it may change the whole structure of what the second lowest cost silver plan is, and therefore the whole structure of people can get maybe a more cost-effective plan.